Welcome to Evidence to Excellence, news in neuroplasticity and rehab powered by the Recovery Project. We want to personally welcome and thank you for joining us today. We're glad that you're here because this podcast is designed to keep you updated on what's new in research and evidence in the neurorehabilitation world. Now, here's your host, Polly Swingle, CEO and co-owner of the Recovery Project.
Welcome to Evidence to Excellence, and today we're going to talk about an injury prevention program called FIFA 11 Plus. So I want to give a little background first on why I chose to bring an expert in on this program. In 2007, the American Orthopedic Society of Sports Medicine recognized that they were seeing in a lot of young athletes a lot of injuries. And with that, they were noticing that these were kind of crucial injuries, that they were seeing so many injuries that these individuals were unable to play sports, and that these individuals were not disabled, but were unable to participate in what they enjoyed doing. And when they talked to all of their other orthopedic physicians, they noticed that this was happening across the country. So in 2009, this organization put together a campaign to look at the prevention of these type of injuries in our young athletes. Now, this is now called the STOP program. So with this said, this kind of has correlated and flown over, or has affected as well as the collegiate sport level. So what we saw in the NCAA is that they also started looking at their athletes to determine why we are seeing so many lower extremity injuries in our athletes. And what they noticed was, what the question was, is it the way we're coaching? Is it the way we're warming up our athletes prior to practice, prior to a game? And does that flow over to the outcome of rehab? So this is not my area of expertise, but I did bring in an expert today so that we can talk about this very interesting program that is very effective called FIFA 11 Plus. So today I have with me Dr. Polly Swingle. I'll let me give you a little background first. Charlie is a graduate of Michigan State University where you received your athletic training degree. At that time, you did have experience in working with the MSU football team, so go green, as well as some other athletes within the MSU. I think you worked with the track team.
Track, field, cross country, women's field hockey.
Okay. Yeah. So then you decided to continue your education, and you went to the University of Miami, and in 2019, you graduated with a Doctorate of Science.
Doctorate of Physical Therapy.
Yeah, Doctor of Science in Physical Therapy. Mm-hmm. So then following that, you took a job in an outpatient facility where you were working with orthopedics, you were working with athletes, and you did have a lot of opportunity to work with some professional athletes within the NFL, within the Professional Basketball Association, as well as baseball players, correct?
Yep, so a lot of probably 60% NFL, and then some MLB guys, so Major League Baseball, a few NBA guys, so from the Professional Basketball League, and then a handful of soccer guys from Europe, different leagues in Europe as well.
So I know just from your experience that you also, when you were in college and a little bit younger, that you played a lot of soccer.
Yep.
And it sounds like, as we dive a little bit deeper into this program, that may have striked you as an interest in learning a little bit more about this program, not just because of the background that you have in your expertise in working with athletes, but probably just an interest too because you were a soccer player at one point in time. So let's dive real deep into this, and I want to learn a lot more about this program. So tell me about the FIFA 11 Plus program, the history of it, and how it came about.
Yeah, so the FIFA 11 The FIFA 11 Plus program is a program that was developed by FIFA, which is the governing body of the World Football Association, really, and so, or World Soccer Association. So FIFA wanted to find a way, just like the NFL has done with kind of rule changes in terms of kind of blindside blocks, low hits below the knees, hits to the head. They wanted to reduce the risk of head injuries in the NFL. We've seen a lot of that in kind of our media and how much even after the players retire they're having issues with all these concussions. And so FIFA wanted to do a similar thing in trying to reduce both contact injuries and non-contact injuries. And so the way that they reduced contact injuries is by changing some of the laws of the game, same the way that the NFL did, to make the game a little bit safer. Now in non-contact injuries, what they did was the FMARC, which is the FIFA Medical Assessment and Research Center, came up with an injury prevention program that is very specific and geared towards, geared to replace the normal warm-up for a team. And this program is meant to reduce the risk of non-contact injuries. And so this program, and we'll go into it and we'll dive into some of the kind of crucial aspects of the program, but this program typically takes around 20 minutes, which as a soccer player or any kind of athlete that does a warm-up before a training or a game, they know their warm-up is around 20 to 30 minutes. So it's meant to replace the usual warm-up.
Okay, so we're going to talk a little bit about the components of the FIFA 11 Plus program. We're going to show you a picture here, so you'll be able to see this picture. And my understanding, and I think you're going to explain this, is that there definitely is a setup on the field for this warm-up. So go ahead, the slide should be up and you guys should be seeing this.
Right, so for the FIFA 11 Plus program, and this FIFA 11 Plus program I also wanted to mention, this is meant for athletes or individuals aged 14 and older. FIFA also has a injury prevention program for kids, that's for the ages underneath that, which we're not going over today, but for this specific program it's meant for athletes or individuals 14 and older. And so for this field setup, what you see here is that you have, for parts 1 and 3, on the right you have 6 pairs of parallel cones, and these are measured 5 to 6 meters apart. And what you'll end up seeing here is that 2 players start at the same time from the first pair of cones and jog along the inside of the cones and do the various exercises that are listed in the FIFA 11 Plus on their way down. After the last cone, the players run back along the outside. On the way back, the speed can be increased progressively as the players continue to warm up. So you start slow, and as you start to get the blood flow going and your warm-up going, you can increase the speed. And you'll see it's labeled on there. A is for the exercises going forward, and then B is showing you the way back. On the left side of the field, you'll see a large mark where part 2 is to be completed, and that's the strengthening exercise. We'll touch on a few of those and some important aspects of those, but that's where you are going to be performing the strengthening exercises. So
let me ask you a question. I know as a mom that had kids that played soccer, and you played soccer, especially when you were 14 up into your 20s. Mm-hmm. When you did a warm-up, was there a focus on the strength component, the speed and agility, or was it more just a skills practice warm-up, I guess?
So it changed as I kind of went through going from, I guess, moderate level to higher level of playing. As I got into college, we had more of a regimented warm-up, and things were a little bit more regimented. I mean, we had a specific warm-up, and we would work on multi-directional stuff, jogging, sprinting, some jumping mechanics. Now, across the board, I've played on many different teams, club level, college level, high school level, and the warm-ups are all different and had certain aspects, but none of them had kind of what I know now is kind of a complete package of what we look at for what's important for injury prevention. And so the FIFA 11 program kind of hits all those components. And if I could, I kind of want to touch on some of the components of the FIFA 11.
Absolutely. I just wanted to add, there are so many times that the younger kids, and to hear that this program really is effective and appropriate from 14 and up, the importance of these younger athletes to really start looking at warming up with some of the things we're going to talk about to prevent an injury that could limit their opportunities to play as they get a little bit older. So let's dive a little bit into some of the exercises, and I'm going to go ahead and let you talk because I know there's going to be some slides that are going to be showing. So tell us a little bit about these exercises.
Yeah, so first the components of the FIFA 11 Plus is it's 3 parts and it's 15 exercises. And so I'll kind of give a brief overview of what each of the parts are, and we'll also kind of provide the actual FIFA 11 Plus booklet with every specific in there if you're interested in the specifics. But a brief overview is part 1 is going to be, this is what you're going to be doing first. This is running exercises at a slow speed combined with some active stretching and controlled partner contacts. And what that means is controlled partner contacts would be like going a shoulder to shoulder challenge, kind of getting your body primed and ready for what you're going to see in competition. And soccer is a contact sport, so you will see that. Part two is meant to be performed at each training session, but not before matches. So parts 1 and 3 are to be performed before competition, matches, games, things like that. Part 2, these are strengthening exercises. These are to be performed before training sessions, but not matches. And I wanted to make that clear. But part 2 is 6 sets of exercises, and they're focusing on core and leg strength, as well as balance, plyometrics, agility. And each of these exercises, you start with the very basic level 1, and then you can increase once you get comfortable with these exercises and they feel easy for you, or as a general rule of thumb, after 3 to 4 weeks, you go to level 2, and the final level would be level 3 for kind of the difficulty of the exercises. Part 3, which is parts 1 and 3 are performed before training sessions and matches. Part 3 is running exercises at moderate to high speeds combined with planting and cutting movements. So these specific parts address kind of all the key elements that we look for in an effective injury prevention program. These parts are what we look at as core strength, neuromuscular control, balance, eccentric training of the hamstrings, and plyometrics and agility. And so that's kind of the basis of the FIFA 11 components, and now that we're going to go into the exercises, and these you'll be able to see up on the screen, and so we'll kind of go in order and touch on a few of the exercises and give some important parts about why these exercises are implemented in the program. So the first exercise you see on the screen here is called the bench, or a lot of people recognize it as the plank. And so this exercise focuses on core strength, stability, and neuromuscular control. And the reason this exercise is included in the program is due to a focus on core training. And now it's important to note that core training is not, a lot of people think of their core as just their abs, right? And so the core is not just your abs or your back extensors. The core also involves the pelvic hip region, so your hip musculature as well. And what research, and there's a lot of research backing this, has shown is that demonstrating sufficient strength and neuromuscular control in the hip and trunk helps to reduce the risk of lower extremity non-contact injuries, because there really is a lot of growing evidence that impaired trunk control is a risk for ACL injuries. Photo 2, what you'll see is called a Nordic exercise, Nordic hamstring exercise, and this focuses on the eccentric or lengthening strength and control of the hamstrings. This exercise is a great way to strengthen the hamstrings, like I said, specifically in the eccentric phase. Research shows that sufficient hamstring strength, especially eccentrically in that lengthening phase, can help reduce the risk of both hamstring strains, because as we sprint with our mechanics, we're getting that knee extension to stride forward and cover more ground, so that hamstring is lengthening but in a controlled manner. And also with knee ligament injuries, such as the hamstrings are a dynamic stabilizer helping to prevent tibial anterior translation, which if we know we have too much of that, that's when we get an ACL injury. Photo 3, you'll see vertical jumps here. And a big thing that you'll see on the slide here is that you want to make sure, and when you're cueing, to avoid certain kind of compensations or poor mechanics such as dynamic knee valgus. We don't want to see those knees diving in. We want to keep good joint alignment. And the reason that vertical jumps are included in this injury prevention program is to address some of the plyometrics and landing mechanics in a controlled environment. So prescribing specific plyometric movements allows us to train functional movement patterns in a biomechanically correct pattern, and in turn we get strengthening and resiliency of the muscles, tendons, and ligaments in those patterns, which jumping, running, cutting, these are all things that we do during competition, during physical activity. Another important exercise that I didn't add onto the screen, but I wanted to touch on a little bit is some of the balance work that's done in the program, single leg balance, and then making it a little bit more challenging as you move through the exercises. But balance training is undeniably a crucial aspect of injury prevention. As we improve our balance, we improve our proprioception, which is kind of our joints telling us where they're at in space. And we also are improving our joint stability, our co-contraction, which helps stabilize that joint. And really what we want to do is avoid any type of significant high velocity, high force movement that takes our joint past its kind of ability for the ligaments, muscles, tendons to hold it stable. And that's where we're going to see whether it's muscular or ligamentous, tendinous injuries. So those are some examples of some of the exercises that you'll see in the FIFA 11 Plus.
So what we always talk about in this podcast, Evidence to Excellence, is evidence. And you've already mentioned evidence on why they've done science, they've done research on why we are doing certain exercises, so on and so forth. So tell me a little bit more about the science, the evidence behind this program, the type of sports and the age groups that are involved in this.
Yeah. So there's a healthy amount of evidence in regards to the FIFA 11 Plus. There's a lot of different researchers that have looked at its efficacy and its effectiveness. And there's several systematic reviews and meta-analyses, which are kind of our highest level of evidence that show support of this program for reducing the incidence of lower extremity injuries. And I'm going to go over a couple of them here that I have in front of me, just in regards to specific, gender specific and age specific, and also sport specific, because of course this program was developed for soccer players, but there is evidence out there that they've implemented this with basketball players as well, and so I'll go over that a little bit. The first kind of systematic review and meta-analysis was by Thorberg et al., and they found a substantial they found there is a substantial injury preventing effect by reducing soccer injuries in recreational, so not our high level athletes, but even in recreational soccer players, by 39% who performed the FIFA 11 Plus. The systematic review also found that the program was effective in reducing the top 4 most prevalent injuries that we see in soccer. And so they reduced hamstring injuries, which is one of the most prevalent, by 60%. Hip and groin injuries, so your adductor, so a groin pull, things like that, by 41%. Knee injuries by 48%, and ankle injuries by 32%. So really significant values there that this program was effective in kind of limiting the amount of injury. Another systematic review, which is kind of our highest level of evidence, by Barango et al., found, again, this was in amateur soccer players, that there was a considerable reduction in the number of injured players ranging from, and so the systematic review looked at a ton of different smaller studies, and they found injury prevention ranging from 30% all the way up to 70%.
Wow.
So really significant there. Another research that was looking at elite male soccer players, so the past 2 ones that I just mentioned were recreational players. This elite male soccer players found that injury rates were significantly reduced, and it was by 46.1%, and the time lost to injury for these elite soccer players who were male collegiate soccer players was reduced by almost 30%, 28.6%. So not only are we reducing the amount of injuries that is occurring, but also the time lost to injury is being reduced as well. And for college soccer players, or for an elite soccer player, a high-level athlete, someone who's really passionate about that type of competition, they know that if you're sitting out and you're watching your team play, or you're on the sidelines, you're not able to perform it to kind of your optimal level, or you're not out there to play with your teammates or anything like that, that can be very difficult. So this program, if we can reduce the time or the amount of injuries and the time lost due to injuries, is going to be super helpful. Another research study that I want to touch on was, I mentioned earlier, basketball players. So there was a, and this was in Europe, they did elite basketball players, so professional level basketball players playing in Europe. And what they found was that during a 9-month season, so injury rates per 1,000 athlete exposures, so exposures to activity, were lower in the group that did the FIFA 11 Plus program, which was the intervention group, than in the control group. There was statistical significance that showed that the injury rates were lower for the intervention group in training injuries, lower extremity injuries, acute injuries, and also severe injuries. So going back to how I kind of touched on, for those college soccer players, there was a decreased loss of playing time. There was a decreased amount of injuries, but also that decrease in losing that playing time. So this one about the basketball players kind of supports showing that there was a decrease in severe injuries, which severe injuries we're going to be missing more time. So even if we're seeing some injuries, they're not as severe at this point too. So this FIFA 11 Plus program is kind of helping both for injury prevention and the severity of the injury. And there's one more.
Okay.
I know, I love the research, so I got one more I want to touch on. So, we talked about recreational players, elite male soccer players, elite male basketball players, and so I also have a research study, a high level of evidence about female soccer players. And so, Stefan et al. Studied the effectiveness of the FIFA 11 Plus program with ages 13 to 18. I know FIFA intended this for 14 to 18, so 14 above, but 13 to 18-year-old female soccer players. High adherence to the program, the FIFA 11 Plus program, saw a 72% injury risk reduction.
Wow.
Systematic review found that there was a 30 to 70% injury reduction rate in female soccer players between the ages of 13 and 17. So for males, females, elite level recreational, the evidence is all there supporting the use of the FIFA 11 Plus for reducing injury rates.
That's pretty significant. I mean,
Yeah.
you don't hear studies that show that high a percentage of effectiveness.
Yeah.
So tell me a little bit about the frequency. So is this every practice before every game that you run through these certain exercises?
Yeah,
Tell me about that.
Yeah. So, and the frequency, again, this is something that I saw a ton in the research too. The frequency is very important to note. And again, I'm going to go over some specific statistics because I think they're important. But again, FIFA 11 Plus, this was intended to replace your usual warm-up. And again, we have the three parts 1, 2, and 3. Parts 1, 2, and 3 are meant to be performed before each training session. Let's say you train 3 times a week. Monday, Wednesday, Friday, you're performing parts 1, 2, and 3 before each training session. Let's say you have a game on Saturday or Sunday. On the game on Sunday, you're just performing parts 1 and 3. Okay? And so, looking at kind of the frequency and does that matter? How much is enough, or is there a certain amount that's a sweet spot, or is...
It's always about dosage, right?
Yeah,
It's
exactly.
always about dosage, right?
Exactly. So what this found for amateur soccer players was high compliance to the FIFA 11 Plus program had an estimated risk reduction of all injuries by 35% and showed significant improvement in components of neuromuscular and motor performance when performing a structured warm-up session at least 1.5 times a week. So training 2 times a week, maybe we're shooting towards, if we round up, I guess we're hitting 2 times a week, right? A really interesting, and this was a meta-analysis done by and a systematic review done by Silvers, Granelli et al. Found an reduction in injury rates by 46.1% for elite male college soccer players, and that reduction of injury was heavily influenced by the compliance. So they looked at the compliance, and so I'm going to correct myself that this one was not a systematic review, but it was a quality research study. And so what they looked at, they had 3 groups: low compliance, moderate compliance, and high compliance. Low compliance, they averaged 13.5 injuries per season, that group. The moderate compliance averaged 11.1 injuries per season. High compliance averaged 8.3 injuries per that season. So from low to high, there was five injury units kind of per season that was lower, so very significant there as well. And looking in, okay, what is that compliance? So the low compliance group, those individuals performed anywhere from 1 to 19 sessions on the season. The moderate compliance group performed anywhere between 20 and 39 sessions on that season. The high compliance group, which had the lowest rate of injury, performed 40 or greater amount of FIFA 11 Plus sessions during that season.
So you are a doctor, a physical therapist, and this sounds great, this program is so effective for the prevention of injuries for our athletes at any level. Why is this important to you to know this as a PT if your primarily responsibility is rehabilitation?
Yeah, so I think having this information in your toolbox is important for a few reasons. Number one, primarily what I do is rehab injuries, so I'm bringing individuals back to function or back to their sport or activity. And a lot of the kind of staples of this program, you also want to make sure you're addressing in rehab to get them back to, when they do go back to their activity or their sport, that they're well versed in kind of really strong in these components of neuromuscular control, trunk stability, and strength. Balance, good, having appropriate balance, having good proprioception so we can tell where our joints are in space. Mechanics with running, jumping, looking at dynamic knee valgus, looking at trunk lean, looking at these risk factors for lower extremity injuries. And so having the knowledge of the FIFA 11 Plus program and what they use in there to prevent injury, and having that knowledge to implement into rehab is going to be super useful, so you don't see your client or your patient back in a few months with whether it's a re-injury or a different area injured, right, from a non-contact injury. In regards to having this in your toolbox as a PT and looking outside of just the realm of rehab for injuries, I think this is a useful tool because we're always looking to promote our profession, what we do, because I think what we do can be so useful to most people out there at some point in their life. And I think that not everybody knows kind of the scope of physical therapy and how far-reaching it can be. And so I think that going and talking to a club soccer coach, a travel soccer coach, a high school coach, even a basketball coach, and kind of really any coach that's involved in athletics, you can say, do you guys do any injury prevention? What's your warm-up look like? And this is a perfect opportunity to say, well, we do a warm-up week, we have them jog, do a couple stretches, and then we get into practice. This is a perfect opportunity to educate that coach. We're backed by tons and tons of research on how you can benefit them and keep their players active on the field, playing, not getting injured as much, and kind of by implementing, not changing the whole way they do everything, but by implementing first 20 minutes of a session, a new injury prevention program warm-up to help prevent injuries and keep everybody healthy. And so I think that it's just a unique opportunity to get in front of those coaches. And then, of course, in the event we can't completely prevent injuries, so in the event that somebody does get injured or anything, that they have a resource. I know that PT, he came and showed us a bunch of useful things. He's knowledgeable, or he or she's knowledgeable. And so I'm going to give them a call and see what they think, even for a consultation. And then that also helps to kind of, if somebody does get hurt, they can come see you.
Right. I think I love what you said about the PT profession. And I know that a lot of PTs watch this podcast, and really bringing our profession out there into the world of not just always being stuck in a clinic, but going out there and going into your communities and going into your teams. And once, being a parent and looking at your kids playing ball and playing on sports, is talking to the coaches and saying, we have this knowledge, and why not share that so that we can prevent injuries and make better athletes, or make people have just a better quality of life. Because as you said, these components of this program, yes, they're great for athletes and the evidence is tremendous, but also just having somebody come in with a sprained ankle and affecting their quality of life, and making sure that the importance of not just treating the ankle itself, but really looking at the whole body and looking at balance and core and all of those components of the program. It really just covers an aspect of kind of musculoskeletal injuries in the lower extremity.
Absolutely. I mean, looking at the mechanism of injury is huge to see, what was the cause of the injury, and was it a non-contact injury?
Right.
And then, it's the opportunity to educate your patient, and again, or the coaches, on how we can kind of reduce the risk of these non-contact injuries by training specific things and specific components. So I think the FIFA 11 Plus is, it's backed by a lot of research, high quality research, so I think it can be very useful.
Well, I want to thank you for attending. I'd love to have you back in another time. We can talk about something else. Sounds like you really have a lot of knowledge in this
I'd
area.
love to.
So I thank you, and we'll see you guys all next time.
Thank you for listening to today's Evidence to Excellence News in Neuroplasticity and Rehab podcast. We appreciate you and hope that you come back every fourth Tuesday of the month to get more of what's new in evidence and research in the neurorehabilitation world. To learn more about the Recovery Project or to find out what we're up to next, you can visit us anytime at therecoveryproject.net.